Hey guys, welcome to our channel. I'm Wefafa Andrew, and today we are going to talk about hepatitis B. I want to remind you that this is your channel where you can find all the information you need about your health at a free cost. You can also consult freely by leaving your complaint in the comment section. I have also a WhatsApp number on my screen there. You can inbox me and we talk more about your health at a free cost. All you need to do is to subscribe if it is your first time, and if you are a returning subscriber, I encourage you to share this video with all the people you care about, because every person has a right to good health. So today we are going to talk about hepatitis B. So let's begin. Hepatitis B is a viral infection of the liver, and it is caused by hepatitis B virus. Now, I already uploaded a video on viral hepatitis, and I covered all the types of hepatitis at once. I mean all the types of viral hepatitis at once. That means I covered hepatitis A, B, C, D, and E at once. And then I also made a video on hepatitis A specifically. Now today I'm going to cover hepatitis B. So what you need to do is to stick around, because at the end of this video I will leave there the links for the two videos. One on viral hepatitis where I covered all the types, and then another one on hepatitis A. So make sure that you watch this whole video and you will not regret. How is hepatitis B transmitted, or how can you get it? One way is that you can get hepatitis B through having unprotected sex with someone who has hepatitis B. The second way you can get hepatitis B is through sharing sharps like razor blades and needles with someone who has hepatitis B. You can also get it through sharing things like a toothbrush, because hepatitis B is also found in saliva. The third way you can get hepatitis B is through infected blood products. For example, if they transfuse you with blood of a person who has hepatitis B, you can get hepatitis B. The fourth way of getting hepatitis B is from mother to child during birth. So those are some of the ways through which one can get hepatitis B. Let's go and look at the signs and symptoms of hepatitis B. Now, viewer, in most cases, you may not have any sign. That means you may just be like the way I am or the way you are. But some people may have some signs and symptoms like yellowing of the eyes. You see, these eyes have two parts. There is a black part and then the other white part. So when that white part you see on your eye when you're looking into the mirror, when it turns yellow and your skin turns yellow, or when you see someone's skin or the eyes turning yellow, that may indicate that that person has a problem with the liver. That may be due to hepatitis B. Another sign is you may just feel weak all the time, and you feel fatigued as if you've worked and yet you're just from sleeping. Yeah, that can also be a sign of hepatitis B. Another sign, you may also just simply have flu-like signs. Like you may feel as if you have flu. If you have ever had flu, you know what I'm talking about. But that flu-like symptoms may last for long. Another sign that is common is you may have abdominal pain. Now that pain is located in the upper part of the abdomen where your liver is located. Just look where I'm touching. That is where you feel the pain. So another sign also, you may have generalized skin itching, and you may also urinate dark urine. You know that in most cases we urinate colorless urine, but when you have hepatitis B, you may urinate that dark urine. So let's go and look at the treatment for hepatitis B. And now the treatment for hepatitis B. For acute hepatitis B, someone may not need any treatment. That means we may just maintain you on things like fluid, just encourage you to eat well and you recover. But if you have chronic hepatitis B, you are advised to take antiviral drugs or drugs which fight the hepatitis B virus. Now you may be asking yourself, what is chronic and what is acute? Now, acute hepatitis is the type of hepatitis that does not go beyond 6 months. But chronic hepatitis is the one that goes beyond 6 months. So I hope there you have understood me very well. Okay, now let's go and look at the tests for hepatitis B. There are some tests available for hepatitis B. They can take off your blood and they detect the antibodies or the antigen for hepatitis B virus. How can you prevent yourself from getting hepatitis B? The best way of preventing hepatitis B is by getting immunized. Yes, you need to go and check for your blood. If you don't have hepatitis B, we have vaccines available for you. They can immunize you. By the way, they have an efficacy of 98 to 100%. So I think those are good vaccines. They are very effective. But hepatitis B is dangerous, by the way. If you don't vaccinate and you get it, it has a lot of complications. So as I finalize, let me look at the complications of hepatitis B. We have majorly two complications. One, you can get liver cirrhosis. Cirrhosis simply means hardening of the liver. You see, the liver is a smooth and a soft organ, but when it gets cirrhosis, it gets hardened. That's why people who have hepatitis and liver cirrhosis, when you press on their liver, you will feel a hard mass, something that is just hard as if stone. It's not supposed to be like that in the normal circumstances. So you may get liver cirrhosis. Another thing, you may also get liver cancer, also known as hepatocellular carcinoma. Guys, hope you found this video important, and if it is so, why not subscribe? Just do it. It is free. Just hit that red subscription button, like and share this video with the people you care about. Thank you very much. God bless you. See you next time. I love you.